The Western Cape government says it will be doubling its COVID-19 vaccine sites from Monday. So far, just over 640,000 people, or 1% of the country's population, have been vaccinated. That's nationwide. Western Cape Premier Alan Winde says sites will be set up at old age homes and in rural areas. Dr. Keith Cloete is head of the province's health department and joins us now from Cape Town to talk more about this. Doctor, evening. Thankful for your time. So the number of sites in the Western Cape is expected to go from 26 to 53. Will they all be operational come Monday morning?
Yes, good evening, Thembekile, and good evening to the viewers. Let me just clarify to you, as of Friday, we had 25 sites. That was 18 public sector and 7 private sector. That 25 sites on Monday moves to 61 when we add 30 public sector sites and 6 additional private sector sites. So we'll land up with 61. All of the sites will come online from Monday till about Wednesday, Thembekile, and it will be fully operational by midweek. Many of the sites will start off with outreach to old age homes, but we'll also then start seeing people over 80-60 at each of the facilities. Our expectation is that we did 10,000 vaccinations in week 1, last week. Our expectation is that by the end of this week, we want to do 30,000 additional vaccinations in this week alone.
And what has been the flow in the process? Because when you look at social media and you listen to people who are calling in to talk radio stations, there's still a lot of concern, people saying they've helped their aunts, their mothers, their grandparents to register, yet there seems to be a delay in the response as to when people will get dates. How are you finding it?
Yes, so what happened, Thembekile, is that the system we're all working on, which is called EVDS, it is an automated system. It is designed to assign people appointments across the open sites in accordance to when they first registered. So people that are registered between the 16th and the 19th of April will be scheduled by the system automatically first. So what our team has done, we have expanded the number of sites, and therefore we opened the number of slots for vaccinations. So what we did on Saturday, for instance, was to start giving people now appointments against those sites till at least Wednesday. And then what we will do on Monday and Tuesday, we will start opening more slots at these sites, and people will start getting more SMSs. And then we hope to stretch it out at 3 days in advance at least that you get your SMS. And by the end of the week, we want to give people at least the appointments 1 week in advance into next week. So that is the plan, Thembekile. And we need to understand everybody that has been vaccinated, the SMS will come, but the system automatically queues you from the persons that first registered after the 16th of April. What we're also doing is, because we know there's an equity issue, we will then also start circumscribing the sites closer to where people live. So if people then started registering a little bit later in certain sites in poorer areas, they will start getting their appointments earlier as well, because then the system starts working the way it should be, which is if you have many sites, you can then register people or give them appointments via SMS at the sites closest to where they live.
And what about vaccines? I know every week we're expecting the arrival nationally of just over 325,000 doses. Are you getting enough at the moment in the Western Cape, especially because you've got these targets in place that you have set for yourselves?
So what we've done, Thembekile, is we've placed our first order. So we had 10,000 in the first week, which we went deliberately slow because we wanted to test the system. We're stepping up to 30,000 target this week, and our target for next week is 60,000. So we have the doses to be able to get us into that rhythm. Once we hit 60,000 a week, that's what we want to maintain for the rest until December.
I wanted to ask you about Sundays. Am I right to say that no vaccinations take place on Sunday?
At this point in time, Thembekile, there's no vaccinations happening on a Sunday. We will obviously assess the situation, and we probably will at some point start adding Saturdays and Sundays, but at this point in time, we've done not Sundays.
Why don't we do Sundays, Doctor? Apologies for cutting you off. Why don't we get people vaccinated on Sundays, especially when nationally we're already so far behind as far as targets?
I think it's, Thembekile, it's more about getting the teams rotated, getting the logistics sorted out. And at this point in time, we're not doing Sundays. But as I say, we will reassess the situation as we go. When some of the bigger sites come online, we might move to a 7-day service. But we definitely is something that's on our agenda. And we probably over the next 2 or 3 weeks will start to get to that point.
And what is the conversation with national government as far as getting those Sunday vaccinations going?
Well, I think it's up to each province to decide how they do it. When we did Sisonke, initially and at some point we ran a Saturday and a Sunday, it's really just about the logistics and the teams getting breathing space and coming back and then scheduling the appointments on the system. But it's really up to each province for them to individually decide that.
Very quickly, Dr. Cloete, the Premier Ellen Windy has issued a note where he says he's quite worried about a resurgence in COVID-19 infections, the numbers rising every day for 12 days now. What is the plan to arrest that situation?
So we're making a very urgent call, Thembekile, and that's why we have this balancing act. The last thing we want to do is that queuing for vaccinations become a super spreader event. That's why we're absolutely careful that we don't do that. We're making a call on all the citizens of the Western Cape, and that applies to the whole country. We can, if we behave in the way that we should, delay the third wave and flatten the third wave. And it's really just about people respecting social distance, wearing the mask, washing their hands, but more importantly, avoiding gatherings. We have picked up that many of these are social gatherings where people let their guard down. So we are making a massive appeal on people to avoid the gatherings. If they have to gather, gather outside, keep it small. I wouldn't be safe going into any place that has more than 20 people, and I don't advise anybody to go into a place where there's more than 20 people, and preferably with the windows open and ventilation. And the last thing is, don't travel into areas with high COVID cases, because that travel is something that actually then brings the cases back to your area as well.
Dr. Keith Cloete, head of the Western Cape Health Department, good to speak to you. Thank you.